Hello and welcome. My name is Dr. Rizwan Qureshi and I'm just enjoying my beautiful weekend here in Hundred Hills in Sydney. I just wanted to take a brief moment and talk about the pathway for specialist. So recently one of the doctors contacted me from Peshawar that he applied for a specialist comparability assessment through Royal Australian College of Physicians and he got substantially comparable. I've also had one emergency physician who was trained in Aga Khan Hospital and who was found to be partially comparable, and now he's working as an emergency medicine senior registrar, eventually taking up his exams. There are countless GPs who are now coming from Pakistan after MRC GP, and I'm pretty sure that we can also use the same success with our MRC GP application with FCPS in family medicine to get them either partial or substantially comparable. So before this, nobody knew what is the the specialist assessment pathway. Now, specialist assessment pathway, all of the colleges, that is the College of General Practitioners, College of Emergency Medicines, College of Surgeons, College of Anesthesia, College of Gynae and Obstetrics, College of Physicians, all of these colleges have got international comparability assessment. So all of these international medical graduates who have passed their exams overseas like FCPS, MD, Arab board or UK exam or US exam, that is the postgraduate exam, all of them who have also completed their training, so their fellowship training in good blend of emergency, in good blend of tertiary care hospital and district level hospital, they can apply for comparability assessment. So what is comparability assessment? They're actually getting compared to the Australian trained specialist registrar, whether they're training back home in Pakistan, India, Arab countries, UK, US or any other countries, and that comparison does not have to be 100%. It could be found partially comparable or it could be found substantially comparable. The point is that after the assessment of that comparability, the colleges will give you a report that you are found substantially comparable, you are found partially comparable, or you're not found comparable. And based on the report, say for instance, if you've been found partially comparable, you need to do further 12 months or max 18 months of further training plus another exit component of the fellowship exam. If you're found substantially comparable, which most of the candidates from the UK, US, South Africa, New Zealand are found, then they don't have to do any exit fellowship exam. They just have to do, some training assessment, even applicable for the radiology as well. Once you've completed all the components of the substantial comparability assessment, then you can go and work as a consultant, independent consultant. And there are plenty of jobs out there in regional Australia, in areas of need, in small hospital. For GP, the opportunities are even more. For emergency physicians, the opportunities are even more. So it's dependent hugely upon how you are applying your application, how you are actually putting your comparison and details of each of the training positions that you've done, how you're matching your fellowship exams with that of the Australian fellowship exam, and then you'll get comparatively assessment. There have been 3 radiologists that I've been working in with now, one from India, one from Pakistan, and one from Nigeria. And they've all been found, partially comparable with a top-up of 12 months, and the one from Nigeria with a top-up of 24 months. And this is applicable all across the board for the anesthesia, for radiologists, for all surgical specialties, for all medical specialties, dermatology, obs and gynae, anesthesia, emergency medicine, and general practitioners. So everybody can apply through specialist assessment. Now, what are the steps of application of assessment? First of all, you've got to decide that you're eligible for that pathway, and basic eligibility for specialist assessment, in my understanding, is that you have to create the EPIC verification of your MBBS and your specialist qualification. Plus, you also have to create the AMC portfolio, so that EPIC verification can be sent to AMC portfolio, which can then later send that credentials to your respective college. Number 2, the application form. A lot of professional skills are required to fill in that application form, because application forms are detailed. You have to really match everything to that of an Australian trained resident, and that's why I actually pay particular attention to the application form. Because it could shave off years of any top-up training if you are partially comparable. After the application form, the interview. Now, most of the colleges, apart from the College of General Practitioners, do conduct interview. The interview goes through expert assessor, and they talk through, what is your training been like, what is your exams been like, what are the component of exams which compared to that of the Australian exam. Plus, on top of that, they may ask you a clinical scenario. Next step in the process is actually to go out and look for the jobs. Now, the jobs, as I said, are mostly located in the regions, in the rural areas or area of needs. So these are the jobs that you can apply as a surgeon, as a physician, as a general practitioner, as an emergency medicine, as a general, any category, as a psychiatrist. So people often ask me, do I stand really a good chance of finding myself a job? Yes, of course. You need to dedicate some time and effort to find yourself a job. So after you've got your comparability assessment, then you can use those letters that I've been found partially comparable, and I need to have a top-up of training for, like, say 12 months, and you need to apply for senior registrar level jobs, which you can easily find in area of need, or you can find in, as I said, district workforce shortage or any other area. Once you got the job offer from that hospital or that clinic, the hospitals actually organize for your visa, for your family visa, and they are responsible for getting you here in Australia. Now, there is a requirement for English language, which is a requirement for the registration. So you must have done IELTS or OET or PTE English exam. That is prior to the registration. Now, there is one thing called moratorium, and you have to understand the concept behind moratorium. So all the international medical graduates are required by law to work in the area of workforce shortages, and that is for 10 years. But that workforce shortage and working for 10 years is from the point of your first registration. And to be honest, for many of the specialties like radiology, anesthesia, emergency medicine, and some of the surgical specialties, these are in major hospitals. So this moratorium does not even feel like that you're working for 10 years in a small place or in far out rural place. It might be applicable more towards the GPs, where they are working in small communities and rural areas. But for most part, for trainee registrars in surgery, medicine, and all other fields, let's go through some of the questions. So one of the questions that I get, I am, a general surgeon. Can I get to work in Australia? What are my, chances like? I've done membership surgery exams. I have done training in XYZ hospital. Membership exams of the UK are not really recognized for specialist assessment pathway. So that is one thing that you must understand. Your training time might be taken into consideration, but you would not be getting recognized for specialist assessment. Now, if you've done fellowship exam, MD exam, Arab board exam, or any other postgraduate level exam in your own home country, yes, you can apply for specialist assessment. The other thing I get asked is that, what are the chances for some of the niche specialties like cardiothoracic surgery, neurosurgery, dermatology, radiology, gynae ops, anesthesia. The chances are there for every specialty, provided you've got a CV to match those chances as per the demand of that specialty. So we've recently got a doctor from Nigeria, and she's got a job in Westmead Hospital in Sydney, and she was found to be partially comparable with top-up time of 24 months. So if she would have been asking this question at the outset, that do I have got a chance of working in Sydney, in one of the largest tertiary teaching hospital in Sydney, of course that would not have gone far. But then again, she applied for the assessment, she got partial comparability outcome, and then it was all done. The question I get asked about is that do you get paid during this assessment? Of course you get paid. In Australia, all of the doctor's jobs are paid jobs. There are no jobs which are unpaid jobs. Either if you're doing jobs after AMC 1 and 2, or either you're doing jobs during, as a senior registrar after the specialist accreditation. I think this is particularly valid for the doctors from India, because they have to pretty much purchase their postgraduate training in some of the private hospitals. The question I also get asked is, how much do you expect the salary in those initial years of training once you've been found partially comparable? So you'll be paid at a registrar level. Your salary would be anything between $120 to $160 to $70,000, depending on your on-call commitment, how many evenings and weekends are you doing. So that is $150 on an average, up to about $160,000 per annum, Australian dollars that is. And if you need any help with this pathway, please visit our website www.emergencyfocus.net, or you can also send me an email info@emergencyfocus.net. I can help you with your initial application forms because I understand what is required in the application form in terms of matching those details to give you a good chance of a successful outcome of your application. Plus, on top of that, there's an interview aspect which is very crucial, and I can help you prepare for that interview. So, drop us a line, more than happy to help you out. Take care, goodbye.